I'd like to welcome you to our webinar today on how employees respond to the introduction of a medical home as a benefits offering from their employer. I'm here with Dr. Kevin Izzard. He's one of our dedicated Paladina Health physicians. And also here with me today are 4 wonderful Paladina Health patients who will talk candidly about their experiences with this innovative healthcare model. Before we begin, I'd like to introduce Dr. Izzard. He will be providing insights into our patient experiences. Hello, Dr. Izzard.
Hello. How's everybody doing?
On an administrative note, one of the best parts of tuning in real time is being able to submit your questions for our presenters to answer live. So please submit any questions you have anytime during the webinar. The earlier the better. We'll queue them up for our panel to answer during the live Q&A portion. Just enter your question into the Q&A tab and click send anytime. So this webinar is designed to answer the question, how do patients respond to a physician access medical home? Did they have concerns when their employer first announced this new healthcare option? What's been their experience with their clinic and their physician? And what advice might they have for other employees whose employers are considering implementing this option? As we look at these questions, you'll hear from Toria, Amber, Clarissa, and Harvey. These individuals are spread across 3 different time zones. They come from different employers and have different needs for their health care. So what do they have in common? The commonality here is that each of their employers introduced a physician access medical home in the last 3 years. So I know many of you are familiar with the concept of a medical home, but for those of you who aren't, we're just going to take a few minutes here today to discuss it. You can read the high-level definition on the slide on the screen. But not all medical homes are alike or operate the same. So we're going to just talk quickly about Paladina Health's physician access medical home and how it does 3 important things. Number 1, it gives patients convenient access to their care provider, in our case, their personal physician. This access includes conveniently located clinics near work and home, but also means leveraging what we call modern-day technology to make it easier than ever to reach their doctor, even on weekends and while traveling. Number 2, it gives physicians a much smaller panel of patients to oversee than a typical primary care physician. Medical homes should provide doctors the time and the tools to oversee the health and wellness of their patients in a much more comprehensive and data-driven way. More services are typically provided to reduce the need to see so many specialists. But when a specialist is needed, doctors in the medical home model should be coordinating care to reduce the complexity involved for the patient and provide continuity of care. And number 3, our model leaves behind fee-for-service. Our doctors aren't incented on volume like in a typical fee-for-service model. They are incented on health outcomes, keeping patients healthy and identifying and treating chronic diseases before they spiral out of control. So the question that many of you might be asking is, how does the quality of health care my employees receive impact my employer's bottom line? So we're going to talk a little bit about how that works. So in my job, I get to speak to current Paladina Health patients as well as prospective patients regularly. A common theme that crops up is that people say they rarely go to a doctor and therefore don't have a specific primary care physician. Then, and this is kind of a quote from someone I spoke to a few weeks ago, when something seems major, like a heart issue, they scramble just to find out who to call. Then that doctor might be able to see them in 6 weeks, but then they feel rushed in, they feel rushed out. Many people say they just want to find someone they can depend on. So a key stat highlighted on the slide here is that 25% of insured individuals say they delay care for financial reasons. We know that employers spend a lot of time discussing these financial aspects of plan design, both in terms of the employee costs as well as the employer costs, and there's so much work that goes on in that area. It's important, though, that there's a lot less time devoted to non-financial reasons that people delay care, and these are important. But regardless of the reasons, these employees are still in your risk pool. They aren't being diagnosed. They aren't being treated for any of the conditions they may have. In our recent webinar on claims analysis, we had a claims expert share that these individuals who delay care show up in what, in his profession, they call a cascade of claims, which comes down the road, both for the employer and then results in a significant health crisis for the patient. So we see this in the clinics, and Dr. Izzard can talk more about it, but our physicians are seeing patients who haven't been to a doctor's office in 15 years or more. So once the employee overcomes barriers to care, oftentimes by necessity, quality of care and a trusting physician-patient relationship are also important for positive health outcomes. So we cite a study from the Journal of Family Practice that found that the higher the trust a patient has in his or her physician, the higher the likelihood the patient will adhere to treatment. And in the traditional fee-for-service system, your employees may be seeing several physicians kind of located across the metro area with no continuity or ongoing relationship or one central point of care. So we feel that now more than ever before in 2014, there are options available that can positively improve the access and quality of care your employees have to the healthcare system. The patients we're about to hear from today are all employed by organizations that chose to offer healthcare benefits that provide this kind of access, convenience, and trust that's necessary to ensure their employees are as healthy as possible. So I've probably talked enough, and so I'd really like to introduce you to sort of the stars of today. First, I'd like to introduce you to Dr. Kevin Izzard. He is a physician in Milwaukee, Wisconsin. He's been with us for about 8 months, and he previously saw patients and taught medical students and residents in the Milwaukee area. Thank you for joining us today, Dr. Izzard.
No, thank you. It's an honor to be here.
Can you tell us a little bit about yourself? I understand that before joining Paladina Health, you've practiced in the private sector as well as taught medical students.
I did. And I can tell you the story that my story is very similar to what you hear from a lot of other physicians. I was on the hamster wheel. You know, I was seeing patients every 15 minutes. And I was actually a little better than most people because I actually had the chance to spend some of my time with teaching, and so I wasn't seeing patients all day, every day. But when I was seeing patients, it was limited to 15 minutes. We were getting more pressure to see more people in less time. And, you know, it was frustrating, especially as someone who's a teacher. I'm teaching medical students to, you know, sit down with your patients, look them in the eye, let them tell you what's going on with them, ask open-ended questions. And in reality, the way that we're practicing is you go in the room and you're trying to get out of the room as quickly as you can because the next person is waiting for you. And so I was always behind, and my patients liked me. They loved me because I listened to them, because I would take the extra time, but I was always behind, and I was always frustrated with that. And so when I first heard about Paladina, at first I didn't believe it. And so it took me a while to actually make the leap, and it was a leap of faith. And I really have no regrets. I think it was the best decision I've made in my career.
What is your favorite part of being in this type of practice?
I think easily my favorite part is that I actually have time to actually sit down with people, and there's not this sensation of being rushed. You know, I can actually ask people, well, how are things going? When you think about a person's health, it's not really just what's going on with them physically. It's what's going on with them emotionally. What's going on when they're in their social situation, you know, their family, their job. There are a lot of things that contribute to the overall health of a person, biopsycho, social, spiritual. And I get to really address all those things. And I think to me, it's rewarding to be able to practice medicine the way that I taught medical students and teach medical students in the way that I learned, you know, to really be able to sit down, listen to people, and to address them as a holistic whole being.
Well, that's wonderful. So I know we have 4 wonderful patients on the phone today. So I will turn it over to you to introduce them.
Okay. So I think you're really going to be excited to hear these stories. We have 4 people that have, they're going to tell us about their experience with Paladina. And actually some of these I'm hearing for the first time, and what I've heard I've really been impressed with. So I'm going to, first of all, introduce you to Toria. Toria is a Paladina Health patient for almost 2 years, and she has diabetes, and her physician has been helping her to conquer her diabetes. So welcome, Turia.
Hello, Dr. Izzard.
Yeah. Can you tell us a little bit about your experience with Paladina Health and how it's been managing your diabetes?
Sure. I do have diabetes since 2010, type 2, and my doctor has been a real partner with me in dealing with it. She makes me feel like I can be honest and proactive about my health, and she never tells me what I can't do. She's always focusing on what I can do to be healthier. She's been so helpful with showing me resources like the Fitbit, which is a pedometer, and the myfitnesspal.com. And over the time, I developed a relationship with my doctor that helped me be proactive about my health. I would always say, I'm going to go to my 3-month lab, and I'm going to lower my numbers. And now I'm pretty proud of myself that I've been on top of my exercise and diet. One thing that's been helpful about this is that we have a regular process for me to communicate my low sugars. She's always following up with a phone call, and she checks in on me and gets me back on track. And I'm so much happier since losing 14 pounds, Dr. Izzard.
Wow. You know, and I want to applaud you on that because I know it's not easy losing weight. It's probably the hardest thing to get a patient to do is actually lose weight. So we applaud you on losing 14 pounds.
Thank you.
I really get a sense that you're excited about getting control of your diabetes. Can you talk a little bit about what it was like before you joined Paladina?
Oh, it's so different. Quite honestly, my old doctor, she would spend more time looking at her laptop than listening to me. And she would always tell me what I needed to stop doing, and I would just nod and leave the office, not really feeling fulfilled. I never had any real one-on-one time with her, so I didn't feel like I could be honest about my diet plan or my big downfall, which was Dr. Pepper. I was really skeptical before signing up with Paladina Health, and I thought it was too good to be true.
Mm-hmm.
But my current doctor, she knows how much I love Dr. Pepper.
That's good. You know, people have to have their vices, right? But that's great. We really love hearing, you know, how our lives as physicians are impacting our patients because it really makes it worthwhile for us. You know, sometimes we get frustrated when patients aren't doing what we say they should be doing, but you know, we realize that it's a long journey, and it's good to hear stories like yourself. You know, that people are really making changes and improving their own life. What advice do you have for the person who's thinking about signing up for Paladina and who thinks that it's too good to be true, like you said?
Well, if someone would have told me about their personal experience, I probably wouldn't have been so skeptical. Just knowing that I can call my doctor at any time is so relieving to me, and my stress level is so much lower. And I love that I can call in the morning, and they can usually get me in. And this personal relationship, it just means so much to me.
Well, thank you, Turia. I thank you for sharing your story. And although I'm not your doctor, I'm very proud of your success. And I said losing 14 pounds is really a big step. So just a reminder, you can ask Turia or any of us questions by entering it into the Q&A tab and then clicking send at any time during the presentation. What ends up happening is that people wait to the end, so you can put them in any time. You don't have to wait till the very end. So now I'd like to introduce another one of our friends here, Clarissa. And she's a brand new Paladina Health patient. Welcome, Clarissa.
Hello, Dr. Izzard.
Hi. Can you tell us a little bit about what your early experience was with Paladina Health?
Yes, it's absolutely been awesome. We started with Paladina in February of this year, and I wasn't sure at first, but decided I'd give it a chance. I'd heard a couple other people in my office talk about how great it was. So I went in for my first appointment, and I totally felt unrushed, had time to talk one-on-one with my doctor, and it was just amazing. Her attention and interest to my care is beyond anything I've ever received for any other doctor. It honestly feels like she knows me, and she actually cares about my health.
Wow, that's great. So how has the way that you access healthcare changed since you signed up with Paladina?
It's actually changed drastically. In the past, I haven't really had any big issues, but anytime I would feel a little bit sick, I would go back and forth on whether I was going to go to the doctor. And most of the time I wouldn't go because I'd have to take off time from work, drive across town, wait at the doctor's office, pay a copay for 5 minutes of their time. So most of the time I just end up waiting it out, and I've been lucky that nothing major has happened that I just have neglected going to a doctor about. So now I'm definitely taking advantage of it. It's convenient, easy to get in. There's no copay, and it's really awesome having a pharmacy on hand so you can get your medications right after your appointment. I'm really hoping I don't have to go back to my other doctor anytime because I really love it.
You can't see me, but I'm nodding my head because I hear, this is what I hear from some other people too, that the ease of access, is really, it takes away a huge barrier because first of all, no one wants to be sick. And no one wants to have to see a doctor. And when you put all these other obstacles in the way, it makes it that much easier to say, well, I'm not going to go. So I'm really happy to hear that, this is working for you. What advice do you have for other colleagues who are considering joining Paladina Health?
Well, like Toria was saying, she was skeptical because nobody had told her how great it was. And, like I said, I'd had a couple of coworkers that had gone, and they're like, oh my gosh, you have to go. So I went, and I came back and did the same thing. My coworkers were just like, okay, well then I guess I'll do it. And I already have one that went like last week and came back and said, oh my gosh, it was so great. I'm definitely going from now on. And I mean, there's no reason not to try it. You will love it.
Wow, that's great. So again, I'm gonna pause for a minute here and remind you that you can. Our audience, you can always send in a question using the Q&A tab and click send. You don't have to wait till the very end to ask your questions, and we'll get to those questions as we finish up. So the next person I'd like to introduce to you is someone who actually I happen to know personally. His name is Harvey. Harvey's been a patient of mine for almost a year, and I thank him for taking the time to talk to us about and tell us about his experience with Paladina Health. Hello, Harvey.
Hello, Doctor. You're welcome.
Hey, it's good to hear from you.
Good.
Yeah. So anyway, when did you decide to sign up for Paladina Health?
Well, I started going to Paladina Health Clinic as soon as it was offered to us here at work. Financially, it's a benefit for me, of course, and my office is about 100 feet away from the clinic, so I don't have to take time off work. And making appointments is real easy.
Mm-hmm. Yeah, Harvey's one of the guys we like to see. He's just upstairs, and he comes down, and he'll drop in, and it's really nice to see his face, and not just as a doctor patient, but to see him as a almost a friend, a person that we really like seeing. He's got a great personality. Anyway, we enjoy having you, and can you tell us a little bit about your experience at the clinic?
Well, first of all, never feel rushed. You always take the time I need to discuss whatever I need, and that's a real comfort. I go to the clinic and feel like I'm among friends, like you just said. You and the assistant treat me really well. It's good to be able to have a relationship with you and the clinic staff. As you know, I'm a little bit older than your typical patient, and I'm still working full-time. Makes things easier that I can get in to see you when I need to and get right back to work. Financially, I appreciate that I've even been able to avoid trips to a specialist because you've been able to provide services for me at the clinic that I've previously had to go to a specialist for. Also, when I went in for my annual physical and the labs came back, I got a lot more detail than I was used to seeing. I appreciated the detail, and it made the experience fun for me because I was learning about my health.
Well, I'm happy that that you found that information useful. Having been a instructor or a teacher of medical students and residents, I always feel that education is important. And when you're trying to empower people to take control of their own medical issues, like I mentioned earlier with diabetes. You really have to get the patient involved and get them in the loop. And I always feel, I take time to try to educate people as why it's important. Why are we concerned about your hemoglobin A1C? Why are we concerned about the blood pressure? Why is it important that you take this medication? So I really believe that, if you can get people to understand and to buy in to the treatment plan, they're much more likely to adhere to it than if it's just coming from someone, telling them what to do. So let's see. Anything else to say to us, Harvey? Any last words?
Well, I'd just like to say try it as soon as you can. You won't regret it. It's going in the right direction for healthcare. It's reducing costs for me. That's real important. And it seems so pressure-free. I'd say give it a try.
Well, thank you, Harvey. Reminder, audience, if you have a question, you can tap on that Q&A tab and click send, and we will answer your questions. One more person I'd like to get to here, and I'd like to introduce to you Amber. She and her husband and her 3-year-old are Paladina Health patients. Welcome, Amber.
Hi, Dr. Izzard.
Hi. Amber, can you tell us a little bit about your experience that you had with Paladina Health Clinic?
Yeah, it's hard to find just one experience. For starters, I would say that I'm kind of a healthcare snob. I've always thought my healthcare down in downtown Seattle, where all of the quote-unquote best physicians are. And I am so pleasantly surprised when I went to Paladina in Federal Way in Tacoma that the care was just phenomenal. I feel like I really know what someone should expect from healthcare. I've worked in the industry for 25 years. And since joining Paladina, I can say that it has meant a lot to have the level of individualized, personalized care that my family has received. From the time I arrived at the facility,
Go ahead.
Yeah, so the time I arrived at the facility, again, skeptical, it blew me away. The facility itself was nice. The intake was phenomenal. Somebody actually sat down with you one-on-one and did the intake. The physician sat knee to knee with me and asked me questions. And when we were done, asked me if there was anything else that he needed to look at. That has never happened in the regular physician's office before. And then upon follow-up, my doctor actually called me himself versus the nurse or the receptionist, which again it just blew me away. That doesn't happen in the real world of medicine. It does at Paladina.
You're a little different in that you have a 3-year-old also, who's also a patient as well. Can you tell us a little bit about the experience that you had with your 3-year-old?
Of course. Again, I had never planned to take the 3-year-old to Paladina. I was going to keep him at his pediatrician's office. I'd been seeing him for 20 years with my older children. But when my little guy got the flu, I opted to give Paladina a try. At the pediatrician's office, I would usually feel like I was wasting the doctor's time because they were so rushed. And so there were times where I didn't take him in because I didn't want to feel the guilt. When I called Paladina and talked to the doctor and told him I felt guilty for bothering him, he emphatically said, that's why we're here, for when parents aren't sure. He treated my son like he was just this special little unique human being. And now my little guy actually wants to go to the doctor even when he scratches his finger because the doctor treated him so well, and they had super cool toys. So they do have children's toys there at Paladina as well. But it's like old school medicine that Paladina is practicing. It just makes a huge impact on families and our care that we're getting.
You mentioned, the doctor said that's why we're here, and it's true, and I say to my patients also, that is, for people that are concerned that that patients are going to abuse their privilege of calling the doctor, I have not found it to be the case at all, because patients, when they call you, they know they're getting you, and if they call you on the weekend or after hours, you know who's calling, you know their story, and it really facilitates things much more easily because You're not sitting at some call center waiting for the stranger to talk about their, their emergency. It's someone that you know, and so I think it really helps. How about your husband? Tell us about your husband's also enrolled in the program, correct?
He is, and he has always been a healthcare avoider, and he had some stuff going on just with his body, and I said, maybe you should try it out. It's been a really great experience for me, and I think that you're really going to like the physicians there. And so I finally made him an appointment and went with him. And again, the care was just over the top incredible. They did not change how they handled his care from how they handled mine. Doctor sat knee to knee with him, went through all the questions on the intake forms with him. Again, once he left the office, the doctor actually called and followed up with him versus a nurse or a receptionist. And when I told him that I was going to be on this call today, he goes, it's a no-brainer. Why wouldn't anybody not go to Paladina? He goes, it just makes sense. And so that was kind of interesting when I told him about the call this morning. He just thought, he thinks that it's just a no-brainer. And now he doesn't wait. He just goes and seeks care. So.
Yeah. It's funny when you talk about men accessing health care. Women are much better about getting their preventive care services. They're used to seeing, getting their pap smears and their mammograms and things. But, for us men, we don't like feeling vulnerable. We don't like, having to go to the doctor admitting that there's something wrong. And in the past, whenever I saw a man, it was either, I was seeing him either because his wife made him come in, wife or girlfriend, or he had something really bad going on, or he wanted Viagra. One of those three things. And so it's good to hear that your husband has had a good experience with, with this Paladina doctor. And, we really want to encourage, your entire family to continue with us, and hopefully we can live up to your expectations. Anyways, I'm going to turn things back over to Leanna. Leanna?
Yeah, thanks, Dr. Izzard, and thanks, Amber, Harvey, and Clarissa and Toria. So I'm gonna, we have about 5 minutes left of slides, and then we want to leave at least 10 minutes for questions, and thanks to everyone who's been submitting them. We do have those, and we'll get to those shortly. We do have a lot of quotes from patients who come in and experience our clinics. I will tell you, though, that we have a pretty powerful story that came from one of our patients who went into the center for a sinus infection. So they increased access, drove her to the clinic, and just through a general discussion about her general health, the doctor was tenacious, and it led within 2 weeks to a diagnosis of cancer that was early stage. And her quote was basically, I went into the office for a sinus infection, and my doctor took the time to put together a few vague symptoms into a diagnosis that saved my life. I've never had a physician so tenacious in finding an answer to my symptoms and complaints. Who knows how far this cancer would have progressed if he hadn't cared enough to investigate things. So we feel, we get these stories all the time, these transformational stories, and we're going to continue to share them as much as we can. So we'll go on just to a few business related. We do have a lot of benefit consultants and employers on the phone. So we're going to turn briefly to talk a little bit about how patients, how the question of how patients respond comes up frequently. But I think our key takeaway here is that an employer in 2014, or as an employer in 2014, you have more control than you think. Most employers think they don't have any way to impact the quality of the health care their employees receive. They think they have control just over the types of plans offered, co-pays, and other traditional benefit design aspects. But I would suggest that Paladina Health and other healthcare models like ours, you have a lot more control than you think. And then we do survey our patients on a regular basis, and we're pretty proud of the stat that 94% are satisfied with the quality of care, and then actually well over 75% say that their health has improved or significantly improved since becoming a Paladina Health patient. So we're going to have just one slide here on how we believe that both what patients want and what employers want kind of intersect in a healthy way in the medical home model. So on this slide, you'll see on the left through surveys about what patients want versus what employers want. And I'd like to point out that the fee-for-service healthcare system, both patient and employer goals can be accomplished. So it doesn't have to be a trade-off. We challenge the either-or notion in healthcare for employers and our patients. So what do you want to do with all of this information? Now that you understand the value of taking patient experiences into account, what can you do? So before we move on to the Q&A, we're going to talk just a little bit about how you can, if you want more actionable information, we're about to release a report of our patient experiences that goes into more detail about what makes a successful patient-physician relationship. The report will cover some of what we've talked about here and provide a lot more insight into the details behind the data. So email kelly.m.bryant@paladinahealth.com or your Paladina Health contact to get your copy. And I encourage you to reach out to your Paladina Health contact if you have any questions about what we've covered here today. So we saved a few minutes for questions here. As a reminder, just type in your question into the Q&A tab and click send. So Dr. Izzard, this question is hot off the press and just came in, and I'm going to send it to you. When there's a care treatment that can't be handled in the clinic, how are referrals done to other systems? Does the primary care doctor keep up with the outside treatment?
Yes. One of the things that someone had mentioned also is that they went to a specialist and the physician talked to the specialist himself or herself. So we'll often do that. We'll often be in direct contact with the referral person. And I think most of us, if you need a referral, we like to work with whoever you've worked with in the past. So sometimes you might be established with a dermatologist or an orthopedic surgeon or whomever. And so, if that person is in network, we'll go ahead and work with that person. But I think the key to this, where it differs from your traditional model, is that we are right there, usually talking to the specialist after you get through seeing them, and coming up with a plan that we're both on the same page, or at least all of us are on the same page. And so, there's some continuity of care, and you're not getting this episodic care like a lot of people have been doing. They go to the emergency room, they go to a specialist. The cardiologist doesn't know what the gastroenterologist did last week, and the gastroenterologist doesn't know what the primary care doctor is doing. So, we all try to be on the same page and all communicate. And so, yeah, that's one way that we, that referrals work. We also, are very mindful of cost, and I know Harvey had mentioned that too. That medical costs, especially in the age of high deductible insurance plans, if you need to get an X-ray, there's a big difference between getting an X-ray at a freestanding facility or getting an X-ray at the hospital. It's probably going to cost you 4 times more at the hospital than a freestanding facility. So often we will try to negotiate those things and try to find, where you're going to get the most cost-effective treatment. Also keeping in mind, though, that quality is important. So we're not going to send you any place where you're not going to get quality care, but we are mindful that, that there are cost considerations.
Thank you. So Toria, this question is for you. One of our attendees asks if you see any other specialists or doctors for your diabetes, or do you feel that you get all the care you need from your Paladina Health physician? And what about her prescription for insulin and other supplies?
Okay. I don't have a need for a specialist. My condition is well controlled with the medication and diet and exercise. As far as my pharmacy, I work with them and I get a 3-month supply, so it's very easy to order on the phone and it comes through the mail.
Great. And then Harvey, there was a question for you. How is Paladina Health helping you reduce your costs? Can you give any specifics?
Sure. In addition to what Dr. Izzard just mentioned about having x-rays and other procedures like that, there are 3 things that come to mind. I don't have a copay when I make a visit, a regular office visit. It doesn't cost me anything for transportation costs to go to another location. And the lab costs for my annual physical were completely covered. There was no out-of-pocket cost for me for those.
Yeah. If I can add under to this, Harvey, if it's okay if I mention this, Harvey came to see me because he had a skin lesion that he was concerned about. Now, normally he probably would have gone to a dermatologist and paid a big fee for the dermatologist to remove his lesion. He came and saw me, and we were able to treat it in our office at his job, during his break time, or when he's able to come down, and it didn't cost him anything extra. So, that's an example of how we can keep costs down. We can do a lot of things in the office that normally would be shipped out.
Okay, thank you. This question came in is how are physicians, and so Dr. Izzard, this is a great question for you, how are the physicians able to spend this much time with their patients?
That's the $100,000 question. And really it comes down to this, is we limit the panel size. So instead of having an average of 2,500 patients, which is the average physician size, somewhere between 2,500 and 3,000 patients, we limit ours to around 500. And because of that, you actually have time that you can spend with patients. And so, in return, they have access to you. But again, as I mentioned before, you can save a lot of time when someone calls me, I know who it is. I know what they're going, their medical history. I know what problems they had last week and what they're going through. And so I can actually cut through a lot of the fog of what's been going on with this person, who this person is. So, that's one way. But the big thing is that people have, we have a smaller panel, and patients have, it's a different interaction that you have with patients in this model. Before, as a physician, we're always concerned about getting phone calls and getting emails because, there's no way to bill for an email, so you took care of the problem by email. Well, you lost out on a payment. Well, with this system, it doesn't matter. We're not worried about the reimbursement because it's all bundled in. And so if I can take care of a problem over the telephone and that person, is satisfied, then we can take care of it that way. I have people that text me. I have people that drop in and, to the office and say, take a look at this, what do you think? And it doesn't have to even be a formal consult. So, we really try to make things flexible for the patients, and sometimes it might be after hours, sometimes it might be before hours, might be on weekends. So, we really try to work with the patient.
Great. I have a couple questions here that I will attempt to field. The first is, what was the benefit incentive to use the clinic that was provided by the employer? I'll first speak generally, and if any of our panelists, Amber at her company, or Harvey, if you have any other specifics on how your employer introduced this benefit to you, you can weigh in as well. So we work really closely with our clients to align incentives with benefits. So some examples might be, well, first, you don't have to make any changes to your benefit plan if you offer Paladina Health, but you can, and we work very flexibly with all of our employer clients. So we'd like to see increased copays for going outside the clinic, for example, to urgent care or the ER, so that they will really take advantage of having the personal cell phones of their physicians and reaching out to them on weekends and evenings when there's an urgent issue to really get a professional opinion. And then decrease premiums for getting annual comprehensive physicals. So, to align the incentives for folks to really access the healthcare system from a preventative basis, but also leverage the Paladina Health structure to get their primary care physician to provide that holistic care and really make good decisions for their patients. Amber or Harvey, do you have anything about your companies?
What I liked was that the program was introduced without any pressure for us to actually partake in it, and we have the It was explained clearly that we can try it, and if we don't like it for any reason at all, we have the option to go back to our previous healthcare provider.
And for our organization, what they have done, at least when it was initially presented to us, is that we were able to keep our regular health insurance provider. So, for example, I'm covered with Cigna, and so we were able to keep that coverage and utilize the Paladina coverage hand in hand. And so, again, it was a very soft rollout, and it was kind of use it if you want, and here are the benefits, or you can continue to use your primary health insurance. And what I found is that using my primary health insurance, the deductibles that I had and the percentages that I had to pay were so large, and the care was subpar. Going to Paladina, I had no copay, no out-of-pocket, and the care was superb. It was a no-brainer.
Great. So the next question, and I know we're going to have to, there's quite a few questions we might not get to in queue, but it kind of dovetails with the last question. If doctors have so many fewer patients, or if employers keep their normal benefit structure, how do we make money, and how does the employer save money? So first, we're always happy to connect you to the business development team member for your area to discuss your specifics. But as these patients have said, our model essentially plugs in to existing benefits programs for self-insured employers. There's no need to change the benefits plan. Employers will still have claims coming in through their insurance. Where we come in is the Paladina Health is a subscription model, so we earn our living on a per member per month basis, regardless of the services provided. The way that we earn an ROI is by eliminating more claims than what we get paid. So on average, an employer might see 35% reduction in claims coming in because more of their health care is being consumed through the Paladina Health physician than it is through specialists and more expensive care. And so the way we earn our ROI is eliminating more claims than we get paid, and it's very transparent and very cost effective for our clients. So I know we're running out of time, and so for those attendees whose questions we didn't get to, we will try and reach out in the next 24 hours to answer those directly. We appreciate everyone's time today. I'd like to personally thank all of the attendees for joining in, as well as thank Dr. Izzard and our wonderful patients for spending such a big portion of their day to talk about their experiences. The webinar was recorded, and it will be available online at www.paladinahealth.com/webinar replay later this week. And also, please mark your calendars for our next webinar. Benefits Solutions for Public Sector Employers, Case Studies from Municipalities, School Districts, and more. It'll take place on June 3rd at noon Mountain Standard Time, and it will show how several employers in the public sector have incorporated Paladina Health into their benefits design. You can register for that at paladinahealth.com/webinar. So we look forward to seeing you on these future webinars. Thank you again.